So for Mr. Jones' first intervention, I'm going to start very basic with him. So given that during the initial evaluation, we saw that he had orthostatic hypotension sitting at the edge of the bed, and how much assistance that he needed during that evaluation, I'm going to start with just bed mobility as my functional movement for him for the first session. Especially given the first session, we're probably only going to be in there maybe 15 minutes or so. So what I'm going to start with is slowly increasing the angle of the bed to where he's almost sitting upright, but in increments. I'm going to check his vitals as I'm doing it, make sure his blood pressure is not dropping, make sure his heart rate's not increasing. Heart rate, from his resting heart rate, we don't want it jumping more than 30 beats per minute over that value. And then for his blood pressure, same thing. We don't want his systolic value to increase or decrease by more than 20. So we're keeping an eye on his values, keeping an eye on his respiratory rate, and then also just overall patient awareness and how he's responding as well. I'm constantly communicating with him to make sure that he's tolerating well, he's feeling well, making sure he's not getting that blank stare that he got in the initial evaluation. But I'm going to start him with just bed mobility. So if we can get him up and he can tolerate it, I'm going to have him sit up, see how he's feeling, maybe incorporate some activities that will help facilitate some rolling. So if we need to, we can reach across to each bed rail, reach across. We can have a lap table in front of him with something he has to reach forward just to get his core activation, which will all directly correlate and facilitate his bed mobility. And the fact that hopefully as he tolerates his treatment more and more, he won't need as much assistance as well. So of course, like I said, I'm going to be looking at his vitals to determine for his intensity. I want to keep his RPE. I'm going to use the RPE scale, hopefully around an 11, but of course checking in with him to see how he's feeling. Blood pressure threshold, keeping that as I spoke about earlier. Same thing with his heart rate, same thing with his respiratory rate. His O2, I'm going to make sure it doesn't drop below 90%. That's also a good sign that he's tolerating it well, or if he's not tolerating it well. So intensity, you want to, being his first session, keep an eye on it. We're going to come back. It's going to be at least 2 times per day. Aiming for about 15 minutes for the first couple sessions, and then gradually increasing the more you can tolerate it. And then if he can't tolerate it, we might see some diaphoresis, that sweating, the pale look. We might see the blank stare in his face, or just communication from him that he's not feeling well and he's not able to do more. And then if that's the case, we just take a step back, we lower that intensity, maybe just do some basic things with him if his vitals stabilize. And if not, we bring him back to normal, we reevaluate our treatment plan, and then we can reassess and change what we do with him, and find out a way that we can still get him mobilized, but maybe not up to that intensity to where he can't handle it.